As we head into winter, our hospitals are running hot and the pressures on the NHS are enormous. Flu season has come earlier with a sharp rise in cases, the peak still to come, and this year's strain more likely to affect older people more severely. Already, the number of patients in hospital in England with flu is the highest on record at this point in the year. It is 50% higher than this time last year and 10 times higher than in 2023. 95% of hospital beds are occupied, growing numbers of staff are off sick, and we are already seeing the pressure in our A&E departments. It is against this backdrop that the BMA is threatening to douse the NHS in petrol, light a match, and march its members out on strike. This represents a different magnitude of risk to previous industrial action. The BMA Resident Doctors Committee is in dispute on two issues, pay and jobs. On pay, resident doctors have already received a 28.9% pay rise, the highest in the public sector. For a first-year resident doctor, that is the equivalent of a £9,400 pay rise. I have been consistent, honest and upfront with resident doctors, but we cannot go further on pay this year. There is a gap between what the BMA is demanding and what the country can afford. Nor would further movement on pay be fair to other NHS staff, for whom I am also responsible, and many of whom will never in their careers earn as much as the lowest paid doctor. Frontline staff and NHS leaders have done a superb job in managing previous rounds of strike action. In fact, the last round of strike action, we did indeed maintain 95% of planned care. And I believe, and we will see when the waiting list figures are published in January, I've got to be upfront with the Shadow Health Secretary and with the House that there is a much different degree of risk this time. So while we're aiming to maintain 95% of elective activity, again, we're aiming to, I cannot guarantee that. And I cannot give that assurance in all good conscience, given the level of pressure we are under. And that is why I just find it inexplicable, actually, that having offered to extend the mandate so the BMA could reschedule the same amount of strike action in January if their members reject this offer, I do not understand why they wouldn't do that. And honestly, and as a Labour MP, I've spent lots of time in rooms with trade unions and negotiating. I honestly cannot think of a single other trade union in this country that would behave in this way. I really can't, and I'm actually shocked by it. And I'm shocked because of the risk it poses to patients. I'm shocked because of the pressure it places on other NHS staff. And I'm shocked because it threatens the recovery of the NHS that we all care about.